Well, joining us now is Africa 54 health correspondent Linord Moudou. Well, Linord, it looks like there's no consensus as far as Zika virus is concerned and the upcoming Olympics, right?
That's right, Vincent. In fact, some experts are raising concerns about holding the Summer Olympic Games in Rio de Janeiro because of the Zika outbreak. However, the World Health Organization says having the Games in Rio, well, as planned, would not significantly alter the spread of Zika. The World Health Organization recently rejected a call for the Rio Olympic Games to be moved or postponed due to the threat posed by large outbreak of the Zika virus in Brazil. Dr. Bruce Elwood is Executive Director of Outbreaks and Health Emergencies with WHO.
WHO's response to the concern about the timing of the Olympic Games in Rio de Janeiro is that based on a very careful risk assessment and all the information we've gathered so far about this disease, these games should go ahead as planned, and we should continue to work to make sure they're as safe as possible.
In a public letter posted online, around 150 leading public health experts say the risk of infection from the Zika virus is too high for the Games to go ahead safely. The letter, sent to WHO's Director General Margaret Chan, says the Games should be delayed or moved to another location rather than Rio de Janeiro. Dr. Anthony Fauci, director of the U.S. National Institute of Allergy and Infectious Diseases, says athletes should focus on evidence, not on rumor.
Athletes and their families have to make a decision based on the evidence. Evaluate what the real evidence is, not what rumor is, not what conjecture is. And the risks is that it's a relatively mild infection. It has almost no mortality or long-range morbidity to it. If you're not a pregnant woman, the dire consequences of this are really that they don't exist.
Zika infection in pregnant women has been shown to be a cause of the birth defect microcephaly, a typical rare birth defect marked by unusually small head size, which often indicates poor brain development. Zika can also give adults the paralyzing Guillain-Barré syndrome. The World Health Organization advises that pregnant women should not travel to areas with Zika virus transmission.
People should practice safer sex or abstain for at least 8 weeks if they are returning from Zika-affected areas and don't present Zika disease symptoms. So these are for asymptomatic people, at least 8 weeks. This goes for men and women.
Zika is carried by mosquitoes, which transmit the virus to humans. The Zika outbreak is affecting large parts of Latin America and the Caribbean, with Brazil the hardest hit. The Rio Olympics is due to run from August 5th to 21. Joining us via Skype from New York City is Professor Igel, Clinical Associate Professor at Tisch Institute and Co-Director for Sports and Society with New York University School of Professional Studies. Professor Igel, welcome to the show.
Thank you. It's good to be with you.
You are one of the authors of this letter that was written and sent to Margaret Chan and posted online. Can you explain to us the scope of the problem as the signatories of the letter understand with this issue with Zika and Olympics?
Well, the problem is certainly with Zika as a virus, but beyond that is the context of Zika as a virus in Rio de Janeiro and around Brazil. What I mean by that is we can go back and forth about whether we think Zika is a severe virus, if it has long-term impact, or it's shorter term, how good it feels, how bad it feels. But here's the issue in terms of time and place. We're talking about a virus outbreak in a region, in a location, where there's already some significant turmoil and turbulence in the economy, in the politics, in the society. And then we're talking about adding a sports mega event to that mix. And the issue then becomes one of resources. Where do you put human resources? Where do you put financial resources? In the present, in the future? How does this whole thing become managed effectively?
So when you look at the fact that the WHO is saying that the event will not significantly alter the spread of the virus, then WHO is the institution that really oversees what is happening with regards to public health globally. So how do you react? I mean, WHO is responsible to ensuring that people are safe. So why would they say there is not a problem there?
Yes, well, World Health Organization hasn't said that there isn't a problem. What World Health Organization said is that the problem is not as severe as we've indicated in the letter. And again, in the letter, we point to what I believe is a good deal of context to this virus outbreak, that it's not just about what we're seeing clinically in terms of a virus outbreak, but that it's about what is going on the ground in Rio, economically, politically, socially, and then the consideration of what happens when there's a festival like an Olympic Games.
So quickly, what are the recommendations from the experts that signed the letter?
Well, we certainly believe that there's a need for an independent panel to make recommendations about what to do in consideration of the Olympic Games going on in Rio in the coming months.
Okay, and Professor Igel, thank you so much for joining us, and we look forward to speaking with you again.
You're most welcome. It'll be my pleasure to come on.
That was Professor Lee Igel. He is co-director for Sports and Society with New York University School of Professional Studies. And that's our health report for today, so stay in touch for more. Find me on Twitter at Linord Moudou. Back to Vincent.